Here I'm going to talk about diffusion-weighted imaging. So this is my outline. First, I'm going to give some brief information as background, and then I'm going to talk about some challenges regarding DWI, and then some common pulse sequences, and then I'm going to make some comparison to conclude the presentation. So here is the background. In diffusion-weighted imaging, some additional diffusion synthesizing gradients are added to the ordinary pulse sequence. These additional gradients create some field inhomogeneities, which also create some additional phase here, as you can see, depending on the position. For example, if we apply a gradient, diffusion gradient along the x direction, we will have an x-dependent phase here. So here you can see the linear increase in the field inhomogeneity and linear decrease in the field inhomogeneity. So if we apply opposite signed diffusion gradients as shown here, in case of stationary spins, the net acquired phase will be equal to 0. But since in diffusion-weighted imaging we are sensitive to microscopic motion of the spins, then the spins will also accumulate different phases in the direction of this gradient and this gradient. Therefore, the phase cancellation will not happen completely, and the signal, the acquired signal, will be attenuated. So how much it will be attenuated will depend on this equation here. Here S0 is the tissue-weighted image, S is the diffusion-weighted image, B is a parameter that we can adjust by changing the duration and the magnitude of the diffusion synthesizing gradients. D is the diffusion coefficient of that specific tissue, and it shows how that tissue diffuses over time. So here you can see an example diffusion-weighted image of the brain. So by looking at this formula, you can say that the signals which are shown here brighter will have decreased diffusion coefficient. For example, here, this is a patient with severe ischemia here in this part. So the brighter parts show the decreased diffusion here. Okay. So these two figures are some examples of pulse sequences used in diffusion-weighted imaging. This is the spin echo pulse sequence, and this is the gradient echo pulse sequence. So if we apply 180 between the diffusion-weighted gradients, then we can apply the same signs. And if we apply gradient echo pulse sequence, then we have to have negative or opposite signs diffusion-weighted gradients. So what are the challenges? The challenges are motion sensitivity, eddy current, signal-to-noise ratio, and some susceptibility artifacts. Okay, so since we are really sensitive to microscopic motion, so we are also sensitive to bulk motion of the head or of the body, which we can model them as translations or rotations. The signal equation that we acquire in normal conditions is like this. But in diffusion-weighted imaging, signal equation in case of translation or rotation, meaning any motion, is like this, which is the shift, which the signal is shifted in k-space here by these amounts, and it also has some global phase in front of it. The derivations of this equation are shown in the report. So what do we have to do to overcome the motion artifacts? We have to have some navigator echoes for motion correction. Some of the example navigator echoes can be seen here. Navigator echoes are simply sampled before or immediately before or immediately after the imaging echoes. They are generally higher in resolution, and they traverse smaller parts in the k-space because they generally only acquire the center of the k-space so that they can know the k-space shift. These are some examples of navigators. So here is a motion sensitivity problem here. You can see that the phases are cancelled in these parts. These are artifacts, and this is a diffusion weighted image of spinal cord in the anterior posterior direction with B is equal to 500. Okay, so in order to have a meaningful SNR, we generally acquire multiple acquisitions belonging to one slice. So if we average these slices with different phases, then we will get some phase cancellations here. Okay, so what are the eddy currents problem? This is also really severe in diffusion weighted imaging because the diffusion gradients are the diffusion weighted imaging uses the maximum gradient available in the scanner system, which is 20 millitesla to 40 millitesla. So they are really huge in magnitude. So that's why the eddy current is a really severe problem. So the eddy current generated by a single trapezoidal diffusion gradient can be formulated as like this. And if, for example, if we had a unipolar two diffusion gradients in the system, then we will accumulate twice of these eddy currents. That's why we have to use bipolar diffusion gradients. So here you can see a comparison. This image is acquired by using unipolar diffusion gradients in B, and A is the low resolution T2 weighted image. Here A is the low resolution T2 weighted image again, and B is the diffusion weighted image acquired by using bipolar diffusion gradients. You can see for example, the distortion effect due to eddy currents here in the frontal lobe, but if we use a bipolar gradient, then that artifact almost disappears. So, okay, in order to assess the signal to noise ratio, I made an experiment in here, UMRAM. Here you can see a diffusion weighted images of brain. And this is the corresponding T2 weighted image of one slice, obviously. In this experiment, I used B is equal to 700, and we know that gray matter and white matter has diffusion coefficient around 900 and 700 times 10 to the minus 10 to the minus 6 millimeters square per second. If we do the math, then we will, for example, here e to the minus bd is equal to almost one half of the T2 weighted image. So the signal to noise ratio is a severe problem in diffusion weighted imaging. Okay, diffusion weighted imaging are also diffusion weighted imaging is also bad in terms of susceptibility artifacts. For example, here here A and C is the susceptibility corrected diffusion weighted images, and these images are acquired with using different sequence than the most common sequence, which is EPI. So here you can see the susceptibility artifacts. For example, here in frontal lobe near the eyes, and here also you can see the anterior posterior view of the brain, so which is elongated.